Good afternoon. Across Canada, there have been over 9,500 cases of COVID-19 and 109 deaths. There's one new positive case of COVID-19 in Prince Edward Island today, which brings our total to 22. This individual is a man in his 50s from Queens County, and it is related to international travel. He has been self-isolating. Yet again, another important example of why people need to self-isolate. I spoke to him this morning, and he is at home and doing well. We talk about self-isolating, and there are always questions about what it means. So just to be clear, if you are self-isolating following travel outside the country or province, it's also important that other members of the household maintain social distancing, ensure enhanced cleaning of all shared spaces, and designate, for instance, a separate bathroom and bedroom for the person who has traveled. If this cannot be ensured, all members of the household should self-isolate for 14 days. Since yesterday, we've had 144 negative tests, which have been we've received, and we've also, since in the last couple of days, doubled the number of tests that have been done at our COVID or cough and fever clinics. We've also want to mention that we have started doing our own limited testing here as opposed to just using the National Microbiology Lab. That has started yesterday afternoon. We have now the 3 cases in Prince Edward Island that are considered recovered. And recovered cases are those who've completed their 14-day isolation from symptom onset and their symptoms have resolved. For essential workers, this is a time when many are leaning on friends and family members to help out with childcare. And we have received feedback from families and friends concerned that this may not comply to physical distancing guidelines. But these cases are exceptions, as essential workers still need to go to work each day and their children still need to be cared for during this time. As announced earlier this week, for those essential workers who do not have any of these options, government is implementing emergency childcare services in order to help alleviate pressure on our essential workers. And this is in line with similar policies across the country in many other provinces and territories, and those children will be screened daily, a small number of children, and lots of consideration about staggering lunch times and spaces. We've also been receiving a number of questions from individuals asking whether or not they should be going for leisurely drives. I would suggest that if you are going for a drive, you minimize the number of people you take with you. The more drives you are taking, the more you'll need to visit a gas station to fill up, where you will come in contact with other people. This is an activity that is best kept to a minimum. Yesterday, I was asked about correctional facilities here in Prince Edward Island. And just a couple of comments on that in this regard. Our correctional facilities are closed to volunteers and visitors. Enhanced cleaning and disinfection protocols are in place. And every new client admitted to a provincial custody will be placed in a 1 person per cell for 14 days with extra cleaning, and clients will be permitted to be out of their room or cell 1 at a time. There are further details, but those are just to follow up from yesterday. Essential workers, any workers traveling to Prince Edward Island for work need to self-isolate when they're not on the job. And we continue to try to emphasize this at the bridge, but this is an important message we are trying to give to people who may be in the construction or who may be driving trucks or healthcare workers. If they're not working, they should self-isolate. I recognize that so many islanders, and by far the majority, are practicing excellent physical distancing as well as self-isolating if they've recently returned from travel. And I thank you. Thank you personally for all you are doing as part of flattening the curve and preventing the spread of COVID-19 here in Prince Edward Island. However, we know that there are still some of you who may not be following the direction we have given. As Minister Myers noted yesterday afternoon, we now have extra highway safety enforcement officers at Confederation Bridge, who they are asking individuals coming across if their travel is essential or non-essential. And if their travel is deemed essential, then they also go through a COVID-19 screening by our public health officers. And this includes gathering information about their health status, what they're doing, their contact information, and if they have someone to support their self-isolation. And now, going forward, we'll be following up daily with every individual who's supposed to be self-isolating to ensure that they are complying with our direction. If they are not, it will be referred to law enforcement to help us in making sure that people are self-isolating if they need to. Prince Edward Island is one of the most densely populated provinces because of our population being spread out across the province. And one of the many things that keeps me up at night is worrying about what will happen if we get widespread community transmission in P.E.I. I don't want us to become a situation similar to the cruise ships that we see in the media. And this is why we have to continue to be diligent in our efforts, and that will be the best way we can protect ourselves and our community. I know people are wondering how long will this last. And although I can't put a definite timeline on this, it will likely be a couple of months. I can say that the more we comply with these public health measures of practicing physical distancing, self-isolating when you need to return from travel, the better chance we have of flattening the curve and slowing the spread of COVID-19 in our province. Thank you. Et juste peut-être quelques minutes en français. Il y a maintenant 9500 cas de COVID-19 et 109 morts au Canada. Nous avons un nouveau cas de COVID-19 aujourd'hui, un homme dans ses cinquantaines, et notre total est rendu à 22. C'est un autre cas relié au voyage et la famille de reliée au voyage. Et cet homme s'est aussi isolé. C'est encore un exemple de l'auto-isolement. Nous avons 3 cas de rétablis ici. Et ce que j'entends par ça, c'est qu'ils ont complété les 14 jours et ils ne présentent plus de symptômes. Je sais que les travailleurs essentiels se fient à leur famille et à leurs amis pour garder les enfants. Il y a des inquiétudes que la consigne de distance physique n'est pas respectée. Mais il y a des exceptions pour ces travailleurs. Ils ont besoin de services de garderie pour aller travailler. Et c'est pour ça que le gouvernement a annoncé au début de semaine qu'il allait offrir un service de garderie pour ces travailleurs pour les aider. On dit qu'il faut tout un village pour élever un enfant. On doit s'unir pour passer à travers. Il y a encore beaucoup de questions si on peut ou peut pas aller pour les balades en voiture. Si vous y allez, limitez le nombre de personnes dans la voiture. Plus de balades, ça veut dire que vous aurez besoin de gaz et ça veut dire que vous risquez d'être en contact avec d'autres personnes. Bref, c'est permis, mais gardez-le au minimum. Comme je dis à tous les jours, la distance physique est critique maintenant. Notre province est très peuplée, surtout dans certaines parties. Nous avons vu de nombreux reportages sur la propagation du virus à bord des croisières et c'est un peu la même chose. Comment ça pourrait affecter notre province si on a la transmission du COVID-19 qui est partout. C'est très sérieux, on doit continuer nos efforts ardus. C'est la meilleure façon de se protéger. Et tout le monde se pose la question, quand qu'est-ce que ça sera fini? Je n'ai pas une réponse définitive, mais ça dure peut-être 2 mois. D'auto-isolement et la distance physique, plus qu'on peut faire et plus qu'on peut aplatir la courbe et ralentir la propagation de ce virus, ça va nous aider. On sait bel et bien que les insulaires sont toujours là pour l'un et l'autre et la meilleure façon d'être solidaire maintenant, c'est de rester chez nous le plus que possible. Merci.
Thank you, Dr. Morrison. Health P.E.I. is continuing our efforts to be prepared and support the needs for screening and testing in the response to the COVID-19 pandemic. Staff and physicians at both our larger hospitals, the Prince County Hospital and QEH, have been working to move patients to other locations where they can be cared for appropriately and safety, and have more than achieved our initial target of 75% capacity. This is creating space for patients who may need hospital care at the QEH for the surge in patients we expect. Everyone within the health system is doing their part as we prepare for additional patients. I want to clarify our plan to care for hospitalized patients with COVID-19 from yesterday. And in our initial phase of response, COVID-19 patients who require hospitalization will be cared for both at the Queen Elizabeth Hospital and Prince County Hospital. Initially, patients, if they need intensive care in hospital, will be admitted to the Queen Elizabeth Hospital, and if capacity at that facility is reached, the Prince County Hospital will also provide this level of care. Both of these hospitals are equipped and ready for patients who have COVID-19. We continue to conserve personal protective equipment now so that we will have it when we have COVID-19 hospitalizations in the future to keep staff and patients safe. The cough and fever clinics, as Dr. Morrison mentioned, with the drive-through testing, continue to see more patients in both Charlottetown and Summerside. Yesterday, 83 patients were seen in Charlottetown and 57 in Summerside. Appointments to the cough and fever clinics are through a referral from your family doctor or nurse practitioner, or through 811 for those who don't have access to a provider. When arriving at the clinics, please remain in your vehicle until asked to come in for your appointment at the site. Health P.E.I. is continuing to offer essential services only, and I want to remind Islanders to please call ahead to the service area to ensure your appointment is on and going ahead before you arrive. Thank you to everyone who is supporting the public health measures and complying with the requirements through the Chief Public Health Office. This is helping us to continue to have no patients hospitalized with this illness and preventing the further spread. So we thank you in the health system for that.
We'll open for questions. I think there's just maybe a little technical thing. I'm unable to hear the question. So I think the questions will then get repeated here in a minute here. They're just sorting out the calls in from the media. So. Okay, so I'll repeat what I understand the question will be. So if someone is arriving back in Prince Edward Island who needs to self-isolate, and maybe they don't have a place to stay, or they're or need a place to self-isolate because where they're unable to self-isolate from a family member perhaps who's severely immunocompromised. So we're having active discussions that are underway with government in order to be able to have a location for these people who may need it. And so I would expect clear direction and clear announcement of where that will occur in the next day, or certainly before the end of the week. So that is something we're actively working on, and I think is really important part of this process, because we don't want to put others at risk who would not need to be if someone's self-isolating, but really emphasizing the importance and making sure someone has an appropriate place to self-isolate. I mean, if there's difficulties with the questions today, we may be able to just have more questions, time for more questions tomorrow. If there's some technical issues, I mean, that we can respond to some media questions by writing, if they'd like, or we can add additional time tomorrow for questions because it seems like there's some kind of technical issue. Is that? I think I'm sorry. I just. We can't hear any questions, so I apologize. Okay, thank you very much.